This was a 60-year-old gentleman who came in with leg pain. When we got the x-rays, I could see that at the bottom of his spine, at the L5, S1 level, he had something called a spondylolisthesis. And that's when one vertebrae has literally slipped forward in front of the other. When the spine is this far out of alignment, sometimes it doesn't cause any symptoms, and I will oftentimes see patients with this exact problem that didn't even know they had it. They came in for something else. But sometimes what can happen is when the spine goes out of alignment like this can cause pinching of the nerve roots. For this particular type of pathology, for this particular type of spondylolisthesis, we call foraminal stenosis. Now, foraminal stenosis is when the nerve, as it comes out of the side of the spine, in what's called the foramen, which is this channel right here, it's when there's pinching of that nerve as it comes out of the side of the spine. And what can happen is when the disc is gone, or when the bones are shifted out of place, you can see how if I push this down, it creates pinching on that nerve root. So at the bottom, this would be sort of like a normal situation. And then if we lose that disc space, you can see how that nerve root gets pinched right there. Pinching of that nerve root can lead to leg pain. In this gentleman's instance, it was a L5 nerve root. The L5 nerve root is responsible for movement of the hip and movement of the ankle, and it supplies sensation to the bottom part of the leg, the outside of the leg, and the foot. So when this gentleman came in, he had a lot of pain when he was walking on the outside of his leg and his foot, and he was starting to get weak in the foot. On the MRI here, we can really see that very well demonstrated. So this is us looking at the MRI, again, looking at us from the side of the spine. Here we have the L4 vertebrae, here we have the L5 vertebrae, and here we have the sacrum. And I love this view because you can really see the difference between a foramen or a nerve channel that is open and a foramen that is closed or compressed. So right here, this is the L4-5 foramen. And if I scroll, we can see that there's lots of white in here. White is good, white is fat. So this gray right here, this is the nerve root, and the nerve root has plenty of space at L4-5. That corresponds with the x-ray. Right here on the x-ray, the disc space is nice and big. The channel right here, the foramen, is big. So that's not the problem. When I look at L5-S1, however, I can see that this nerve root right here, this gray, it's got no white around it. It's completely compressed. So we can see this structure right here. This is actually the L5 pedicle. And then we can see the S1 body or pedicle down here, and the nerve root is getting compressed between those two. So for this gentleman, relieving his pain, to do so, I had to reestablish the disc height in order to give the nerve more space in the foramen. In other words, the ALIF also helped me alleviate his foraminal stenosis, which means that I gave more room to the nerve root in the foramen, and that's what helped his leg pain. So you can see that after doing this procedure, what we've done is we have established this spine alignment. So now, whereas before you could see the front of his L5 was not lined up with the front of his sacrum, now the front of the L5 is lined up with the front of his sacrum. Not only that, but we also have established lordosis. Lordosis is a backwards angulation, and that's the natural shape of a native spine. With this gentleman, he had lost that lordosis. So you can see that the angle between these two vertebrae here was around 9 or 10 degrees. Most people have an angle of around 20 degrees for the bottom L5-S1 segment. So what we've gotten him to here, we've actually gotten him even more than that, or probably a little less. We've got him to around 33 degrees. So we've reestablished the lordosis. We have reduced the spondylolisthesis, meaning we've gotten the bones back in place, and we've provided him with enough structural support in order to heal his fusion. Right now, this gentleman is 9 months out of surgery. He's doing very well. He's back to all activities.